Can a doctor go ahead with a high-risk surgery of spine based on medical scans that are about 2 months old? And if something goes wrong, who is responsible? The hospital, the doctors, or both? Welcome back to Docnur. In this video, we break down a real-life case of alleged medical negligence decided in 2024 by National Consumer Disputes Redressal Commission, involving the death of a 24-year-old male about 6 months after spinal surgery. The patient had suffered a serious neck injury as a child, causing a condition called Atlanto Axial Dislocation or AAD. Over the period of 15 years, patient suffered from muscle weakness, breathing issues, and was wheelchair bound. In September 2011, he was admitted to a government hospital in Jaipur for surgery. But before it could happen, he left the hospital without informing doctors and consulted a private neurosurgeon from Fortis Hospital. The neurosurgeon reviewed the government hospital reports and advised X-rays. On the subsequent day, 2 neurosurgeons consulted the patient and diagnosed him with mobile Atlanto Axial Dislocation due to fracture of odontoid process of C2 vertebral body. They advised surgery and explained the risk to attendants. 2 months later, in November, the patient got admitted to Fortis Hospital in Jaipur. No fresh MRI, CT scan or cervical X-rays were done before surgery. Consent was obtained, and on the night following admission, the 2 neurosurgeons performed the surgery. That is, internal fixation of posterior arches of atlas and axis with MRI compatible wiring fixation for AAD. After the surgery, patient was shifted to the ICU. On post-operative day 3, the patient underwent a tracheostomy, and on the subsequent day, the patient underwent transoral decompression. Throughout his stay in the hospital, patient stayed in ICU and was discharged on attendant's request on 26 December 2011, still being on a ventilator, and shifted to another private hospital in Alwar. Sadly, on 1st May 2012, the patient died during the course of treatment at hospital in Alwar. The cause of death mentioned was quadriplegia, respiratory failure, and sudden cardiac arrest. Here, the patient's father filed a complaint of medical negligence before the State Consumer Disputes Redressal Commission of Rajasthan, demanding 94 lakh rupees in compensation. The State Commission ruled in his favor and awarded 50 lakh rupees, saying that both the Fortis Hospital and treating doctors were negligent. But the hospital and doctors appealed the decision to National Commission. In the appeal, the doctors argued that they were experienced professionals and had explained the risks of surgery. They said that patient's condition was continuously worsening due to a 15-year-old spinal injury, and post-surgical weakness was a natural outcome of such a risky condition, not necessarily negligence. Primarily, the doctors claimed that consent had been taken, surgery was performed as per standard medical practice, and complainant has not provided any medical evidence or any expert medical opinion to establish their negligence. Doctors added that patient was conscious and responding when discharged from the hospital, that proper neurological post-surgery care was not provided, which was very important. They claimed that hospital in Alwar was not even made a party and medical records of that hospital were not brought on record. But the patient's father had a different story to tell. He argued that doctors took consent for the first surgery only, after which they performed 2 procedures, tracheostomy and decompression, both without consent. Even high doses of steroids were used after surgery without informing the family. The doctors rushed the surgery without doing any updated investigations, relying only on 2 months old scans. He claimed that diagnosis of mobile reducible AAD was not even confirmed, and 2 months old preoperative MRI showed only AAD. The doctors performed surgery on a presumptive diagnosis without confirming with fresh or other investigations which could have been done before the surgery. They performed the surgery in haste, guided by financial motives, when there was no emergency to do the same. He added that even the surgery performed did not match what was needed for his son's actual condition, that is AAD with OS. As MRI done after the surgery still showed spinal cord compression and a displaced fracture, it meant that surgery did not fix the core issue. Post-operative scans even showed new bony fragments in the spinal canal, which were not present before, raising concerns that the surgery itself caused the further damage. He stated that before surgery, patient was conscious, breathing normally, and had good muscle strength in all his limbs. After surgery, he never recovered and remained on a ventilator until his death. To counter the claim of neurosurgeons that patient was conscious and responding at the time of discharge, the complainant produced a certificate dated 8th April 2012 from hospital in Alwar that patient had been brought to the hospital in a critical care ambulance on ventilator, and he continued to be on ventilator since he could not be weaned off. The complainant also clarified that the patient was shifted to hospital in Alwar on account of high costs of treatment at Fortis Hospital, with bills of about 6 lakh rupees for 34 days treatment, against his agricultural income of about 2 to 3 lakh rupees per annum. National Commission found medical negligence on the part of treating doctors for not conducting pre-surgery investigations, not obtaining informed consent except for one surgery, and not meeting with the standard of care as no material change in patient's MRI findings was noted. Addressing the question of treatment at second hospital, the National Commission clarified that cause of death certified by a doctor is legally acceptable in absence of an autopsy, and the argument about lacking treatment records of hospital in Alwar is not supported by any material to establish there was a negligence in treatment at that hospital. The National Commission revisited the stand of Honorable Supreme Court of India in medical negligence cases, taking the viewpoint expressed in V. Kishan Rao versus Nikhil Super Speciality Hospital that negligence could be inferred from the facts when medical professionals and hospitals had exclusive control over the situations, and nature of damage suffered suggests that it would not have occurred without negligence. National Commission held that Res Ipsa Loquitur is applicable in this case, and commented that State Commission's order with respect to neurosurgeon doctors is well reasoned, but not able to establish any specific negligence against the hospital and its medical superintendent. Allowing the hospital's appeal, National Commission ordered the doctors to comply with State Commission's order. Final key takeaways: this case draws a clear line. Doctors are not expected to promise miracles, but they must follow protocols, obtain full consent, and act with reasonable skill and diligence. Also, hospital and management cannot be held responsible for the individual negligence. In this case, it is noteworthy that the complainant, despite being a layperson, engaged deeply with complex neurosurgical issues, medical records, and procedural details. He supported his claims with documentary evidence wherever it was necessary, raising pertinent questions about diagnosis, treatment decisions, and consent. This uncovers a broader shift in the landscape of medical negligence litigations in India. As legal literacy expands, the intersection between healthcare and law is becoming more dynamic. This case serves as a reminder to all stakeholders about the critical value that meticulous documentation, informed communication, and ethics in clinical practice. Let us know your thoughts in the comment box. If you find this case interesting, like and share this video, and don't forget to subscribe to Docnur. Until next time, stay informed, stay safe.